Hi, everybody. I am so excited about today's guest. And y'all know I love the topic of data, because we have learned in the last couple of months that it is time for us to know every detail of what is going on in our practice, as good as, if not better than, all of the insurance companies that are out there. On top of that, there's so much incredible, useful information that can be used for research purposes, for treatment, and that is why I'm so excited, because research is like my heart. And I am so excited to have Dr. Goertz here with us today. I first learned about her awesomeness from my very dear friend, Dr. Jay Greenstein, who is no stranger to this webinar series, and all the work that she has been doing with the Clinical Compass over the years. And I'm going to post the link here in the chat box again, because if you're not checking it out, if you're not looking at their resources, where have you been and what are you doing? But on top of that, she does so much more than that. She's a professor in musculoskeletal research at Duke Clinical Research Institute and director of system development and coordination for spine health in the Department of Orthopedic Surgery at Duke University. She's also the CEO of the Spine Institute for Quality and an adjunct professor in the Department of Epidemiology, College of Public Health at the University of Iowa. Look, her credentials are amazing. So I really am excited to have her here. This is a huge honor. Thank you so much for making time in your schedule to be here today.
Well, thank you so much for inviting me. I really, I'm excited to have this opportunity to look. I'm trying to share my, as you know, all of these things, when you're trying to share your screen, it all works fine before you get on board, and then then it doesn't work quite so much. But anyway, Christy, thank you so much for that very kind introduction. I really appreciate it, and I'm very excited to be able to spend some time with all of you this afternoon to talk about something that is also my favorite topic, which is data. And so our topic today is data. It's not just for scientists anymore. And just really briefly, what I want to do is I want to talk about how data influences both the U.S. healthcare system and chiropractic practice, talk a little bit about how to harness the power of data in your office, and then I'd like to open it up for a discussion. I know we'll be having that discussion via chat, but still hope you'll be thinking of questions that you might have or comments, so that we are able to have a conversation at the end of this. So we're going to start with talking about the influence of data. And there really are two ways that data has an impact. The first that I'm going to be talking about is the impact on the healthcare environment. And second is actually what it teaches us about chiropractic specifically. So I'm going to start out with talking about low back pain. I know we see a lot of other things in our office besides low back pain, but low back pain is really a pressing problem in this country, and we're starting to learn more and more about both how prevalent it is and its impact on our population at large. So low back pain right now is the #1 cause of global disability. And there's a 80% lifetime prevalence, which means that 80% of people have low back pain at some point in their lives. Whenever I'm giving a talk about chiropractic or low back pain to a group of non-chiropractors, I always say, how many of you have had low back pain at some point? And that 80% pretty much holds true. That there are roughly 1 billion people in our world that are impacted by low back pain at any given point of time. And the total estimated healthcare costs for both low back and neck pain were $134 billion in the United States. That makes them the #1 expenditure in healthcare in 2016. That's the latest year that we have data available. And you combine that with those statistics with what we're now learning, what the data is teaching us about commonly used treatments. And what we're learning is that many of them result in unacceptable levels of harm and are often not effective. And I could have, I'm going to pick on opioids for obvious reasons, but I could also, if I had more time, I could delve into what we know about NSAIDs, acetaminophen, and other common treatments for spinal surgeries, corticosteroid injections. In many cases, they are delivered far more often than clinical guidelines recommend, and they definitely have harms associated with them, often harms that are outweigh the any potential for positive impact. So with opioids, this gives you some idea of overdose deaths, how overdose deaths have been evolving in the United States over the past decade and a half or so, and things are starting to drop off just a little bit, but the picture still looks pretty close to this. Sales of prescription opioids in the United States nearly quadrupled from 1999 to 2014, but there was not an overall change in the amount of pain that Americans reported. So use of opioids going up, but patients were, the overall level of pain was, if anything, was increasing. It was certainly not decreasing. In 2018, there were 46,800 opioid-related deaths in the United States, which is just slightly less than there were in 2017. And prescription opioid-involved overdose deaths were more than 4 times higher in 2018 than in 1999. So definitely, this is a problem that continues to plague us, and I know that you're seeing in the newspaper, as I am, that there's concern that opioid deaths and opioid misuse is rising during the pandemic as well. So opioid-related costs between 2015 and 2018 were approximately $2.5 trillion, according to the White House. When you consider healthcare, lost productivity, and the impact on a criminal justice system, and then the value of a statistical life when you're looking at considering premature death. And getting back to that point about the fact that the amount of pain that Americans are experiencing has not decreased as the use of opioids, and this is a really excellent study. I recommend that you take a look at this if you're interested. It's the effect of opioids versus non-opioid medications on pain-related functions of patients with chronic back pain or hip or knee osteoarthritis. One of my friends and colleagues, Dr. Erin Krebs, was the primary author on this clinical trial. And what she found is that treatment with opioids was not superior to treatment with non-opioid medications for improving pain-related function over 12 months. And the authors stated that the results do not support initiation of opioid therapy for moderate to severe chronic back pain. So all of this, so as we become more and more aware of the public health crisis that's presented by low back and neck pain, it's very common, it's very expensive, we don't have good outcomes, we don't have good treatments. More and more the data has started to lead any number of organizations to develop guidelines that for treating musculoskeletal conditions or non-cancer pain. And those guidelines range from the Food and Drug Administration to the Joint Commission for Accrediting Hospitals to the Centers for Disease Control and also the American College of Physicians. I'm going to just spend a minute on the guidelines for the American College of Physicians. So were published in Annals of Internal Medicine just about 3 years ago. And what they recommended is that patients and physicians and patients should treat acute, subacute, and chronic pain with non-drug therapies before any prescription medications. And the treatments that they specifically recommended was things like spinal manipulation, yoga, tai chi, acupuncture, with spinal manipulation being the only treatment that they recommended for both subacute, acute, and chronic low back pain. So the second thing that that data has an impact on is the chiropractic evidence base. So what I'm going to do now is just talk a little bit about what we know about chiropractic because of the data that we have collected so far, primarily over the last 20 years. I'm going to start with low back pain. So there are approximately 100 reviews of spinal manipulative therapy, which is roughly equivalent to the number of studies themselves. But about half of these are systematic reviews. And the reason why that's important is because of the graphic that I have on the right-hand side. So this graphic is called the evidence pyramid. And what it shows is that systematic reviews are considered to be the highest quality of evidence that exists. And the reason for that is what they do is they in a systematic way, they look at all of the studies that have been published on a particular subject, and then they go through and look at the populations and how similar or different they were, what kind of outcomes they had, the schedule that they used to collect that data, all the things that can really influence the results of a study. And then they pull it all together and try to make some kind of a sense of what that data all looks like. And this is really important because if you follow the literature very closely, you'll see that, and if you follow the research that's reported in the newspaper, you'll see that, one study will say that well, a few years ago we were told that having 1 or 2 glasses of wine a day was probably good for you and led to better health outcomes. Now we're learning that that same amount of alcohol consumption is probably not good for you, and that the risks outweigh any health benefits. So it's that kind of, so what systematic reviews do is take a look at all of the literature, both the studies that said there's no risk and the studies that said there may be some risk, and pull it together, and often with some kind of recommendations. So I'm gonna give you an example of one of the studies that have been is just starting to be included in some of those systematic reviews because it's a newer study. It was published in 2018 and in JAMA Network Open. And this link at the top right here is where you can go and get this article for free. It's open access, and or you can just Google JAMA Network Open and my last name, and that will also allow you to pull it up. We've had over 87,000 people have looked at this article since it was published, making it one of their top accessed articles. And what we did was, this is the largest study of a clinical trial of chiropractic. We looked at what happens if you add chiropractic care to usual medical care for patients with low back pain. And this was a study that was conducted at 3 sites within the Department of Defense with 750 people altogether. And what we found is that the changes in both patient-reported pain intensity and disability, as well as satisfaction with care, were favored those that received chiropractic care in addition to usual medical care, and that the magnitude of effect was similar to what we've seen in other studies of just spinal manipulation. It's important to keep in mind that this study was not of spinal manipulation per se; it was of chiropractic care, and that the size of the difference was big enough to be rated as to be consistent with what both the American College of Physicians and the American Pain Society has determined to be a moderate magnitude of effect. Just to give you an idea of what this data looks like, you'll see that those the dotted lines are those that were usual care only, and the solid lines are those that also received chiropractic care. This was low back pain intensity, and essentially you can see that all of the dashed lines are above the solid lines, and you see pretty much the same exact thing for low back pain related disability, which we measured using the Roland Morris disability questionnaire. And this gives you an idea of the patient perception of improvement since baseline. So with the blue bars are those that received chiropractic care, and the more purple or burgundy bars are those that received medical care only. And you can see that the majority of people that received medical care only thought that they were about the same, where the majority of people who got chiropractic care felt that they were much better. So now just really quickly, neck pain and headaches. The Bone and Joint Decade Task Force on Neck Pain and its Associated Disorders found that mobilization, manipulation, and clinical massage were all effective interventions to manage whiplash-associated disorders or neck pain and its associated disorders. Regarding headaches, there are a number of studies that show that manual therapy, including manipulation, mobilization, soft tissue therapy, or exercise, are more effective than medication in the short term, and at least as effective in the long term for muscle tension headaches. That cervicogenic headaches can also be effectively treated by these same treatments. And there's even some growing evidence that spinal manipulation may also be effective for migraine headaches. So there's a little bit less data on migraines than there is for some of the other types of headaches I've mentioned. I want to be comprehensive, so I just want to say a word about the evidence for spinal manipulation for non-musculoskeletal conditions. And what I would say is that this is an area where we have a lot more research to do if we're going to be making claims regarding efficacy or effectiveness. And there have been very few. I don't think there's a single really well-powered study, a multi-site study of spinal manipulation for a non-musculoskeletal or viscerosomatic conditions. That there are a number of studies out there from everything from hypertension, which I've personally done several of those studies, to dysmenorrhea, to infantile colic, but most of them are pretty small pilot studies, and the results are either negative or inconclusive. So regarding safety, this is something that you see also in the news every now and then. Most is primarily having to do with cervical artery dissection. But in my own experience with the research that I've conducted is that patients sometimes will feel mild to and transient symptoms, such as increased pain or stiffness or muscle spasm or even fatigue following manipulation. But that generally is short term and not very severe. Regarding cervical artery dissection, there are a number of studies now that have looked at this. The best studies are large cohort studies that have looked at tens of thousands or hundreds of thousands of people, and those findings are consistent in that they show that people that have a cervical artery dissection are at least as likely to have seen a medical doctor as a doctor of chiropractic in that time leading up to their stroke, and the authors uniformly conclude that patients are likely to be suffering some symptoms that can indicate that a stroke may be in progress, and are seeking health care from either a chiropractor or a medical doctor, and that's what's going on there. Regarding costs, we need to do a lot more work when it comes to costs of chiropractic. And again, this we're starting to have more opportunities now with large data analysis, but it's always difficult to do cost studies because we know that patients that see a doctor of chiropractic tend to be a little bit different than patients who don't. They tend to be a little bit younger, they tend to be a little bit healthier, they tend to be in a higher socioeconomic category. And all of those things are things that also independently impact cost of care or healthcare utilization. But we're getting more sophisticated with the statistical tools that we have to be able to look at some of that data. And so increasingly, we are able to control for some of those variables that might impact what the costs look like. And one of those studies is the study that I quoted at the very top here, which was a study that looked at over 12,000 people that filled out something called the Medical Expenditure Panel Survey. And what we found when we did that study was that with patients that had both low back and neck pain, those that saw a doctor of chiropractic actually had lower annual overall costs for spine-related conditions than compared to people that were not chiropractic users. And we found a couple of other studies, one that looks at what happens if care is initiated with a chiropractor versus a medical doctor, and then what happens if chiropractors have systematic access to managed care. And in every case, the costs were lower if a person went to a chiropractor than, but again, this is an area where we really need to do more research. So now I want to shift gears just a little bit and talk about, I've been talking about our data, with a big D, so large databases and doing randomized clinical trials and systematic reviews, but many of you are probably not going to be involved in conducting that kind of research. But you can be involved in conducting research in your office every single day and thinking about ways to use that data, the power of that data in your clinical practice. And so I'm going to talk about three things, really: using evidence to support your clinical care, and in discussions with other healthcare providers, payers, health systems, and patients, a little bit about collecting data in your office, and then briefly some ways to stay current on the data. So first, we're going to talk about using the evidence. So I have been involved in a number of multidisciplinary healthcare settings throughout my career in lots of different ways. And I am frequently the only chiropractor that many health professionals have ever seen up close. And I always joke and say that they're very impressed by me in it, but it's not because I'm so impressive. It's just because their expectations are so very, very low. And over my years in 25 years, 30 years in chiropractic, I have run into many of the same barriers that you have about inclusion of chiropractic. But my feeling about why those barriers exist is, first of all, I think many times people just don't think about chiropractic care as an option. We're not part of mainstream medicine. We don't go to school alongside other healthcare professionals. We are sometimes less included in some of the environments that they frequent, and they just simply, chiropractic just doesn't cross their mind when they're looking for pain management solutions or other treatments. I think there's also a lack of information or misinformation. So people are not aware of, people tend to pay most attention to where the literature was when they went to school. I think actually, medical doctors might be a little bit better about staying current with the literature than some of my chiropractic colleagues, but I think that is somewhat universal. We knew a lot less about chiropractic as far as the research goes 20 years ago than we do now. So in some cases, other clinicians or health systems just are not updated in the current research. And sometimes there is a level of misinformation or bias that where they're just not going to consider chiropractic no matter what. But I do have to say that I consider that to be much more uncommon than some of these other barriers. And then the last is legitimate concerns regarding the quality and consistency of chiropractic care delivery. So every primary care physician that I talk to has several stories about a patient who really got not very good advice from a chiropractor, or was asked to prepay for 100 visits, or et cetera, et cetera. As a physiatrist told me one time, well, the problem is, Christine, that the patients that go to good chiropractors don't come to me, so I never see them. But so that may influence those concerns, but they definitely are there. So a problem that we face problems that we face have to do with quality, consistency, transparency, and just the uncertainty that I was talking about just a moment ago. And in every case, I think the solution is data. So I'm going to talk a little bit about how you can collect data in your office and what that might look like. So collecting data in the chiropractic office, I believe that it helps engage in processes thought to lead to better care. So for instance, collecting patient-reported outcomes and incorporating that data into a treatment plan can actually help you take better care of patients. That participating in clinical data registries, and I'll talk a little bit more about clinical data registries in a minute. Measuring patient satisfaction, I recommend the CAPS Ambulatory Care Survey. I know there are some other things out there also. And then making your clinical practice data publicly available to patients and using it to benchmark yourself against other clinicians can also be useful. So I'm going to start out by talking a little bit about patient-reported outcomes and why they're important. So the research shows us that clinicians traditionally have a poor understanding of how patients are impacted by the disorders from which they suffer. And by that I mean that physicians tend to rate their patients as being more healthy and in less pain than the patients rate themselves. So if you're feeling that your patient is coming in and they and you're just mentally giving them a pain rating of 2, but the patient is giving him or herself a pain rating of 8, you can understand why from a patient-centered care perspective that they might be starting off on the wrong foot. The patient-reported outcomes can really help to get doctors and clinicians on the same page so that they're able to come up with the best treatment plan possible. And there are a number of outcomes and process measures that don't adequately describe the patient experience. So for instance, if you're taking a patient's blood pressure and the measure that you get credit for is that you took the blood pressure, but you're not actually looking at that blood pressure and using that to make sure that you are coming up with the best treatment plan for the patient. You're really missing out on the things that matter the most to patients. And finally, PRO data collection can really lead to better outcomes because of the kinds of shared decision making that I mentioned just a moment ago. So how can you collect patient-centered outcomes? Well, I recommend using Promise. So and the website is below. It's at healthmeasures.net, and there are a number of measures that you can take a look at. These are available in the public domain. So if you decide to use Promise measures, you would not have to pay for that. And this just gives you some idea of measuring pain intensity in the past 7 days. How would you rate your pain on average, from no pain to worst imaginable pain? And this is, people tend to think of measuring pain intensity as being pretty simple, and it is simple in a way, but the complex thing is in how you ask the question. So there's a really big difference between asking a patient, what is your pain right now, versus what's your average pain been in the last 24 hours, versus what's your average pain been in the last 7 days, versus what's the worst pain you've had in the last 7 days. All of those are completely different questions, would give you completely different answers. And so you want to be asking the same question in the same way every time, so that you're able to really measure patient progress over time in a systematic way. And another instrument that I really like is the pain interference form, which it was really focused on how much did pain interfere with people's day-to-day activities, with their work around their house, their social activities, and their ability to do household chores, which are all things that really matter a lot to many patients. Then patient satisfaction is also another outcome measure that's incredibly important, and health systems and other providers are really starting to focus more and more on patient satisfaction. Why? Well, we know it's correlated with lower risk of malpractice claims. NCMIC has a really nice article about that. If you want to reach out to me afterwards, I'll be happy to send you a copy. It helps you identify opportunities for improvement, including overall satisfaction with your care, the helpfulness of your staff, and ease in making appointments. So things that really matter to patients. And then patients who are satisfied with their care are more likely to make referrals. So if you're able to identify opportunities for improvement and make sure that you're really optimizing the patient experience, then that can lead to not only better care for individual patients, but the opportunity to care for more patients along the way. So how can you measure patient satisfaction? The Spine Institute for Quality is actually has a program that allows you to directly measure, that allows us to collect the data directly from your patient using the CAPS ambulatory care clinic and group survey. And it includes a number of questions ranging from how what their overall rating is for you as a provider, to how helpful and friendly are your receptionists. And if you're interested in finding more, if you'd like to fill out a sample instrument just to get a sense of what it looks like, you can just text CAPS 3 CAHPS3 to 641-329-0652. And if you don't get that, again, if you want to send me an email, I'll be happy to send it to you. And it just gives you a sense of what the questionnaire looks like and what the patient experience would be like if they were to fill it out. Because what happens is you would give the patient a piece of paper that gives them some information about how to access the survey on their phone or via their computer. And then all they have to do is text the number to this phone number in the same way that you would be doing, and then they get the survey to fill out either on their phone or on the computer in the same way that you'll be able to do if you do this. And then I also want to just spend a moment to talk about clinical data registries. I have spent a lot of time trying to figure out how to make clinical data registries work for doctors of chiropractic. I don't think we're quite there yet, but this is something that's going to be increasingly important as the Centers for Medicare and Medicaid and others ratchet up their interest in clinical data registries. And why are they important? Because they help us collect. Just imagine if we had a database that had all kinds of outcomes and utilization and cost data associated with 10 or 20 million patients. We were able to look at outcomes and cost, and we would be able to answer questions that are really hard to answer with through randomized clinical trials, because we just need so many more people to be able to answer them. I mean, things like describing the natural history of disease. So there's still so many things we don't even know about low back pain and neck pain and other things that chiropractors treat, to determine the clinical effectiveness or cost effectiveness of healthcare services. Let's look at pediatrics. We really don't know nearly as much as I wish we did about care of children, and a clinical data registry would just be a great way to start, so we even knew what questions we should be asking in our clinical trials. And then finally, to measure and monitor both the safety and the quality of care that's delivered. Clinical data registries give you an ability to benchmark yourself against other clinicians. You're able to use them to identify best practices. So when it comes to chiropractic, we still don't know nearly as much as we need to know about the optimal number of visit levels, what techniques work best for what conditions, etc. What kinds of things in addition to spinal manipulation are going to lead to best outcomes. And clinical data registries can really help us get there. They can help us provide feedback or benchmark mechanisms. So if you're in your clinical practice and you think you're doing pretty well, but you start collecting data and you find out that your average, your patient is getting about 2 points better on a pain scale, but that the other chiropractors in your community their patients are getting about 4 points of improvement, then it really can help you think, stop and step back and really think through what you're doing and ways to maybe do a little bit better. It helps to open up a dialogue between you and payers and purchasers and policymakers and stakeholders to be able to go and say, hey, this is my data. I'd like to practice in this multidisciplinary, and you're a multidisciplinary practice, and I believe I would be a really good fit because here is the kind of data I collect in my practice, and here's what I've learned from that data. And then finally, building a community of chiropractors who are committed to data-driven healthcare delivery. So, a cadre of people so that it brings you together, through chat rooms and other mechanisms so you can help tackle some of the problems that we all face together instead of separately. And then, as I mentioned before, the Centers for Medicare and Medicaid have had a quality payment program that really is focused on clinical data registries for several years now. They have, whether chiropractors could participate or not, first they were participants, and then we weren't able to participate, and now we can opt in to participate. But because of integration of clinical data registries with electronic health records and other barriers, this still is a pretty tough thing to participate in right now. But I do see this changing over time. So if you are interested in clinical data registries, this just gives you an idea. This is the physical therapy outcomes registry. This is the spine registry for the North American Spine Society, and this is the Spine IQ clinical data registry, which is the only registry that's been designed specifically for conservative spine care. And then just really briefly, staying current. The first thing would spineiq.org. We have a back blog that you can sign up for. So we'll send you an email once a week that focuses on evidence-based chiropractic treatment. We have our back facts that are information sheets that you can use for your own interest, or that you could print out and hand to patients. They're formatted really nicely. There's the WFC suggested reading list. You can search by topic, and it's curated by leading chiropractic scientists across the world. And then also signing up for Google Scholar alerts. If you and I think this is Walden University has a nice website on exactly how to sign up for Google Scholar alerts, and you can either search by topic if you're interested, or you can search by author name if there are chiropractic scientists or other scientists that you're interested in following. If they publish new work, you'll get an alert, or if there's a new study on low back pain or neck pain or whatever your area of clinical interest is, you could sign up for that also. And then I am remiss in not including Clinical Compass on this list as well. But I'm assuming you already are familiar with that way of staying current also. So, in conclusion, I think there's an unprecedented opportunity for greater inclusion of chiropractic care within the U.S. healthcare system. In fact, I don't think there's ever been a better time to be a doctor of chiropractic, because we are truly experts at treating some of our nation's most difficult conditions. And our outcome, when you look at our outcomes and our safety profile, we are doing really well when compared to all of the other treatments that are currently out there. As the data that we have in cost isn't as robust as it needs to be, but there's every indication to believe that care initiated by chiropractic is going to lead to overall lower costs than care initiated by some other providers. And as we become more and more focused on the costs within our healthcare system, and especially the number one spend, which is low back and neck pain, health systems are going to be looking for ways to save money. The fee-for-service system that we live in now, my colleagues in health policy circles are telling me that we are very close to that transitioning from a volume practice to value, which value is really looking at not only, did you perform the service, but what were the outcomes, and then what is sort of the cost, the calculated cost per outcome. Doctors of chiropractic should do very, very well in that new environment. And the quote I want to leave you with is by Leon Megginson. A lot of people think Darwin said this, but it was Leon. And he said, "It's not the most intellectual of the species that survives. It's not the strongest that survives, but the species that survives is the one that is best able to adapt and adjust to the changing environment in which it finds itself." So we are now in a situation where we are where I think the future of chiropractic really depends on our ability to adapt and adjust, and so to speak, and that data is the tool, that data is the great leveler. Data doesn't care where you went to school or what or whether the MD down the street thinks that all chiropractors are quacks or not. All it cares about is what's actually happening in the world, and so it's really an amazing opportunity for all of us to come together as a profession on behalf of the patients that we serve. Now, I'd be happy to open this up for some chat. Let me just try to stop sharing. Hey, Christine, you're still there?
Hi, I am still here, and I took so many notes. I did put the link to the Spine IQ website in the chat box, along with Clinical Compass, which they're very familiar with because I talk about it every week, anytime I can squeeze it in. And I will say that the Spine IQ website does have some amazing resources. In fact, Dr. Goertz was a speaker at the North Dakota Chiropractic Association Midwinter Convention this past weekend. And one of the comments that we saw the most pop up during the virtual event was how much they loved the resources that were available on the Spine IQ website, who was her sponsor for that session. So we don't have any questions yet, but if you do have them, please submit them. But we did have a couple of people who wanted to say thank you so much for your excellent presentation. This was really well done. It's my favorite topic. And I think that sometimes we get so caught up, or that you guys get so caught up in the treating of your patients, you forget how valuable the information that you're actually collecting is to the rest of the profession.
Mm-hmm. No, I think that that's really true. I mean, it's valuable it's valuable on many levels. It's valuable to your patients because it can help you take better care of them if you're collecting data and understand how their health trajectory is going, and it can help manage patients, because we've all had the situation where a patient comes in and they're saying, I'm just really not feeling any better. I don't know if I should keep coming. And you feel like they just need maybe a couple more visits. If you're able to say to them, you came in and your pain level was an 8, but now you're at a 5 or a 4, but you've only been there for a time or two. I think we can get you to a 2, so let's keep working at it. And so it allows you to be able to have those kinds of conversations with your patients. It also helps you have the kind of conversations with policymakers and payers and healthcare systems that if you're interested in multidisciplinary care and referrals. And then finally, it helps with if you can contribute to an overall large database, it helps us answer some of those questions that I spoke about earlier.
It does. And I've seen some amazing ways that research has helped the chiropractic profession as well, not just in how patients treated and improving their outcomes, but when it comes to the battles with payers, with what should be covered, versus what they actually cover, or when they stop covering services altogether. And this is Dr. Goertz is one of those people who's a wizard behind the curtains that's gathering all of this data and information and helping in all of this research that is being utilized by your national associations, by your state associations, by the clinical compass to say, hey, you're saying that this isn't an ineffective treatment, but we have the proof right here that says it is. And they can't do that if they don't have enough people submitting that data.
Right. That's it. That's exactly right.
So several people wanted to know how they could get notes. Like they were taking notes, but they would love a handout for today's presentation. Is that something that they can reach out to you for?
Yeah.
Or
if you want to reach out to me at cgoertz@spineiq.org, I will be happy to send you a notes page.
Perfect. I'm putting that in the chat box. So y'all can just copy that into your emails. Y'all can send that request on over. Any questions, y'all? Everybody's being a little shy, not so talkative today. I should have opened it up today with, what did y'all do this weekend? So, does SpineIQ offer tools that demonstrate cost offsets associated with patient improvement scores?
Well, I wish that we actually had that, that we had enough information about chiropractic cost data so that we were able to offer those kinds of tools. But that's exactly the reason why we need to all be involved in, these large, data collection efforts so that we're able to start collecting the kind of data that we need to create those tools.
Wonderful. So as a provider, is there a way to automate the CAHPS-3 questionnaire after a patient visits, and how often should it be done?
There are some ways to automate it. I mean, you'd have to send them information, but you could automatically send patients an email after their visit in order to complete the survey. So absolutely, and we'd be happy to talk to you about some ideas on how to do that.
That's a great question.
Mm-hmm, it is.
From Alaska.
One of my favorite places.
And that's a great way to implement it. Oh, it's mine too. I'm still heartbroken that COVID prevented me from my trip in October.
Yeah,
it's my favorite place to go for all.
I lived in Alaska for about 6 months after I graduated from high school, and it's just absolutely one of the most beautiful places on earth. So.
It is the most beautiful place. I was so excited to my first snowplow. It was parked, not in service. My first snowplow that I saw in action was in DC while I was visiting Jay Greenstein. And I may or may not, in the middle of a meeting, have stopped everybody so I could stick my head out the window and take a picture. And since you're in North Carolina, although y'all probably see snow a lot more than we do in Mississippi, it was quite the sight to see.
No, it is quite the sight to see. There's no question about it.
We will not be denied our excellent 50th anniversary celebration in 2022. Dr. Goertz should come. I agree, because I'm going to be there.
Well, there you go. Well, I'll look for the invitation.
Oh, don't worry. I'll remind you. It's literally on my schedule every 2 years till infinity. And it says in October, like the first weekend in October, Alaska trip. This is one of the best events I've ever been to in my life, even when they're not celebrating something as awesome as 50 years for their chiropractic association. I love the rest of y'all too. I really do. I love to visit everybody. I just really love going to Alaska. So, not to hurt anybody's feelings that's watching this. But yes, so if y'all think of any other questions, our sweet speaker has been kind enough to share her email address again to request the handouts for today. But if y'all are like me, inevitably, I think of the question I wish I would have asked 30 minutes after a session is over. So shoot those over to her. I read her bio, so y'all saw how busy she is, like crazy busy, with all of the different things that she's juggling. But just rest easy, because I've never seen anybody who's so responsive and busy when she answers emails. And I know, because I've been emailing her a lot the last 2 months for different things that our schedules have overlapped on. So just rest easy. Your session is coming. So your answer is coming for your question. So just reach out to her and be on the lookout because, again, y'all know research, data, and the importance of all this. I've been saying this for the last couple of months, how important it is. So I'm going to find a way to sweet talk her into coming back this year so we can talk about it again and see what else we've learned in the last 6 months with all the additional data that's being gathered, because y'all are all going to start submitting your data.
No, that's it. That's exactly right. And, I challenge all of you to just go on to Google Scholar and set up an alert to get the latest research on one topic, or just to go to JAMA Network Open and search for my name and download that one article that I mentioned, so that you just have at least sign up for the Spine IQ back blog, so that you'll get this information delivered right to your inbox every Wednesday. To do something so that you're able to access the data in one way or another.
I completely agree. And I put that link to the JAMA Network article in there. And again, you can still, there's so many published papers that you have been a part of that I see on the regular with my work with other organizations. They'll say, look at the latest article contributed by Dr. Kristen Goertz and other people. So y'all have no idea. This is a woman who's working really hard for this profession, for your patients. And again, hopefully we can make it work out with your schedule, that we can have you again here later this year so you can talk some more and let us know what's been going on. And of course, then you and I are going to be in Alaska together in 2022 since we just made the date.
Looking forward to it. Well, thanks, Christy, for being such a gracious host, and thanks to everyone who joined us. We look forward to continuing these discussions. Have a great evening.
Bye, y'all. And just a reminder, we have a webinar next week. Is your EHR creating vulnerability to your protected health information in your practice? There's a checklist of things that you need to know from your EHR provider to make sure they're doing everything they can to protect your patient's information. Then we're going to talk about unlocking your practice's cash flow with Dr. Corey Frogley. And then we have a new speaker, not a doctor. He's not a doctor. I just say that about everybody. But it's Charles Waterloo. And opportunities and applications for cost segregation for your building and leasehold improvement. So this is really important for your practice building, the physical structure. He has some amazing information. I've learned a lot from him in the last 2 years, and I'm really excited that we're able to finally get him on the webinar series. So we'll be posting some more webinars coming up into March. Be on the lookout. We have new speakers coming that we have never had before, because it's time to refresh and open our eyes to all of the amazing things that are going on in chiropractic. But if there's a particular topic, coding, documentation, those important things that we still have to talk about that you want us to cover, just let me know. Or if you've heard a speaker at a virtual event or at a local event that you want to share with the rest of the country, email me and let me know who they are, and I will track them down and see what I can do to get them here. I hope you all have an amazing rest of your day and a fabulous week. And I will see you next week, same time, same place.
Bye.